Illinois Masonic Medical Center has been Howard Brown's friend for many years. Some of you in the audience tonight may recall that in 1994, we presented Illinois Masonic Medical Center with our Friend for Life Award, specifically for Unit 371, which was the AIDS unit at Masonic. Back in 1994, Masonic was doing the right thing, helping us help those who were suffering from HIV/AIDS. Today, Masonic continues to do the right thing, helping us, helping all of those in our community provide better health care, competent health care, compassionate health care to the people who need it. Recently, Howard Brown received considerable funding to do breast and cervical cancer work for women in our community, but we couldn't do it alone. We went to Masonic and asked Masonic to again step up and help us, and without hesitation, they did. That's what Masonic does. So tonight, we are very happy and pleased to recognize Illinois Masonic Medical Center as yet again our friend for life.
So the reason that I wanted Illinois Masonic to have the Friend for Life Award this year was because of the work they had done to help us make the Illinois Breast and Cervical Cancer Prevention Program come to fruition for our patients. And Illinois Masonic went above and beyond the cause to make it easy for us to do that. They made that program work within 72 hours when it would have taken us months. What we were able to do then was to take this whole group of women who could not get services anywhere else and get them services in a very caring and compassionate, culturally competent environment. And we have worked with them to make our referrals from here to there seamless, and they have bent over backwards. And done something that I think for a major hospital system in a city to do, to work with a community health organization that commits their services to such a unique group of patients, I think is a huge thing, because they didn't have to do it. But they have done that across every program and every service we wanted to provide. They've come back to us and said, yes, we will make it happen because it's a worthwhile project.
Illinois Masonic has absolutely valued and enjoyed its partnership with Howard Brown for 15 years, if not more. Howard Brown is the absolute recognized leading facility of its kind, if not in the Chicagoland area in the Midwest. The truth of the matter is people define Howard Brown too narrowly, particularly in the non-gay community. They see Howard Brown as an HIV/AIDS facility, and it's not. Howard Brown is a healthcare facility. Howard Brown responds to the health needs of a community that it serves, however that community is defined. So it's an absolute natural evolution that healthcare would now be partnering with Illinois Masonic in diseases of an oncologic nature. I am absolutely certain that as the needs of this community changes, that Howard Brown will be at the forefront, hopefully partnering with Illinois Masonic. We would like that very much, to continue to provide services however the community defines it. Thanking Howard Brown is a very easy job. I'm glad personally and very selfishly that Howard Brown's part of my life. I'm glad from an interinstitutional point of view that Howard Brown and Illinois Masonic are joined, symbiotic in terms of moving forward to provide care to this community. I also want to warn Tom Barrett that I knew him when he was a resident at Ravenswood Hospital, and if things become too difficult, I'm certainly not above dragging up some of his storied past. But in Tom, you have an exceptional clinician leader. And I need to reemphasize that David Moore and David Blatt have laid a foundation that Tom is the natural successor to. And I'm proud to be here on behalf of Illinois Masonic. The clinicians are the people who are important, not administrators, but I'm happy to accept this award and just look forward to many, many more years of positive collaboration, not for our institutions, but for the people we serve.